Welcome to this poster presentation on My Mind Star. Before I launch into telling you about this particular study, I wanted to give you a little bit of context, which is that My Mind Star is one of a suite of around 40 tools, collectively known as the Outcome Star. You may have come across the Recovery Star, which is the version for adults with mental health issues, or the Life Star, which is for people with learning disabilities, or the ADHD Star. So these tools have a number of common features. They're all holistic tools. They're tools that are collaboratively developed and are designed to be completed collaboratively. They're strengths-based and developmental tools, and they're dual-purpose tools. So they're designed to support the person to make changes towards improving mental health or other outcomes. And they're also designed to capture the change that's happening. So they're designed to achieve outcomes and also measure outcomes. So on to the development of My Mind Star. This is a project that was initiated by the charity Action for Children, who had noticed an increase in the mental health issues faced by young people they were supporting. So the aim was to develop a version of the Outcome Star for young people experiencing mental health problems, particularly in early intervention settings such as schools and youth services, but also in more formal settings such as CAMS. The method that we used was to draw together a working group of young people and also frontline workers working with them and managers of services to explore two key areas. One of those was, what are the key outcome areas? What are the key things that all contribute towards good mental health for young people? And because it's a holistic tool, we wanted to identify a whole range of different areas. And the second was, what are the steps that young people take towards getting to the point of good mental health? So this supports, this is because it's a developmental tool. We want to look at what are those steps and what is it that young people themselves can do to improve mental health, and what people supporting them, how people supporting them can empower them in that way. So through these working groups and focus groups and supported by a literature review, we identified 8 key outcome areas, and you can see these on the poster arranged in the shape of a star. We also identified a 5-step model of change of how young people achieve improvements across all of those different 8 areas. And that model starts with stuck, where the person doesn't recognise that things are not okay or isn't able to kind of reach out and accept help, through to accepting help, and through to taking a much more active role in improving things for themselves and learning what works for them. So on the basis of these 2 ingredients, a detailed 5-point scales were developed for each of these 8 outcome areas. And in the tool, there's detailed descriptions for each of these scales, and the actual chart that's completed by the worker and the service user together is this radial diagram. And so the idea is that there's a conversation between the young person and the worker on each of these areas. Their readings are plotted on the star, and the points can be joined, and it gives a very simple, intuitive picture of how things are for that person at the moment, and that's a really good basis for agreeing an action plan. And then when the actions have been taken, maybe three months later, something like that, the process can be completed again. There are new readings, and the difference between the 2 gives a measure of change. So this was piloted with 177 young people using 67 workers. The results were very positive, with good psychometric results, as you can see here on the poster, and also very positive feedback in terms of the impact of the work on young people. So as a result of this, some tweaks were made to the tool, and it is now being published and is in use by a number of charities and local authorities. Thank you very much for listening. If you want to find out more, please do contact us.